I was out of practice and I just felt like I was struggling and not really seeing results that I wanted. I felt like I wanted more out of my profession. I wanted to be better at what I was doing.
I wanted to do a residency at the time because I know for me, I just really need some structured learning. And a residency did that. I felt overwhelmed with all the evidence that was out there, the variations of treatment. So I kind of wanted some guidance from experienced clinicians to show me their ways and tell me what they've tried and didn't work and what they tried and did work, while also outlining a very structured didactic schedule for me.
The depth and the breadth of things that you're able to do will go way beyond what you probably even think they will. You get to learn clinical things, you get to learn diagnostic pieces of examination, you get to learn research, you get to learn speaking. I mean, it's just such a well-rounded program. It's hard to even articulate how much you get from it. You get way more out of it than you would probably even think that you would.
We were able to talk nationally, regionally, state level for conferences, and then also conducted our own research and then taught within a DPT program. And I felt like that was, one, is going to bolster your resume in any areas that I want to pursue with continued speaking or teaching, but also just give me the confidence, maintain the level of professionalism, and set me up for the right path in my career as far as beyond clinic care.
It's really almost one-on-one the entire time you're there. You're learning literally every day really valuable information the entire time you're there. Getting that over the course of 365 days, day in, day out, is just invaluable because you learn what would take you normally 30 years to learn in the process of 1 year.
Gundersen has so many things that you can do. Certainly there's the bare minimum you have to do to complete the residency, but there's so many resources there. I feel like I could have got a lot out of it. Even if I did a 2-year program, I probably wouldn't have hit all the resources that I could have done there. So I'd say be in the now, really focus on the material you get there, and then really utilize all the resources and go after things that are off the curriculum but interest you.
It's changed my entire life, just day-to-day friendships and people who I can call to ask questions. If I have a question about research or a question about a given patient population, there's so many people now that I know that I can call and would be happy to help me in a second. I would have never met any of those people if I hadn't went to Gundersen.